So now let me discuss the multiple choice questions in the topic of acute pericarditis and as well as the constrictive pericarditis. So we have a 36-year-old woman presents to the rheumatology outpatient clinic with 2 months history of stiff hands and as well as wrists. She mentions that pain is particularly bad for the first few hours after waking up and is affecting her work as a dentist. On examination, wrist, metacarpophalangeal joints and proximal interphalangeal joints are swollen and warm. What will be the cardiac examination finding in this patient? The options are ejection click, tumor plop, pericardial knock, loud S1, opening snap. So, what is the diagnosis of this patient? That is rheumatoid arthritis. And in case of rheumatoid arthritis, what are the cardiac abnormalities that can be seen? The cardiac abnormalities that can be seen in patients with rheumatoid arthritis is constrictive pericarditis. They can also have development of mitral stenosis. They can also have development of the mitral regurgitation. So, what will be the cardiac examination in these patients is there can be pericardial knock, because these patients with rheumatoid arthritis, they are developing constrictive pericarditis. And not only that, there can be also the opening snap. Why? Because rheumatoid arthritis can also cause mitral stenosis. And not only that, there can be even loud S1, because in patients with mitral stenosis, how will be the S1? There will be loud S1. Okay. And where do you see the ejection click? Ejection click, you see that in patients with aortic stenosis and pulmonary stenosis, that usually does not occur in patients with the rheumatoid arthritis. And tumor plop is an additional diastolic sound heard in the right or left atrial myxomas. Okay, so the answer here is C, D and as well as E. But if it causes constrictive pericarditis, you will listen pericardial knock. But if there is mitral stenosis, you will listen the opening snap and as well as the loud S1.